This is Dr. Volker Musahl from the University of Pittsburgh Medical Center, and I'm going to show you today how to conduct an isolated lateral meniscus allograft transplant using an all-soft tissue graft and a centralization stitch. The ideal patient for this procedure is the patient with lateral joint line pain, status post a lateral meniscectomy. So commonly it's your discoid meniscus patient or the patient that had a radial split that couldn't be salvaged. For a lateral meniscus transplantation, I always use a centralization stitch. The reason I do this is to make the compartment slightly smaller so that the meniscus allograft has a better fit. Remember that the capsule and the meniscus are not intimately related in the lateral compartment as they are in the medial compartment. So a centralization stitch will help. To help me conduct this procedure, I use the FIRSTPASS Mini for the centralization stitch, and I use the FastFix Flex to help fixate the graft. The flexibility of the Flex allows me to create fixation in the posterior horn and mid-body of the meniscus. So in my first step, I usually centralize the capsule. I don't put a stitch in the lateral meniscus, but I like to bring the capsule in a little bit in these lateral meniscus cases. So if I can see the first pass, and in this case I use one that's curved to the left. Let me see if we can deliver a suture into here. Maybe. So I try to bring in a horizontal mattress type of configuration without grabbing the popliteus. Let me see if I can get some good tissue here potentially. My preference in these cases is I pass a centralization stitch, and so now I bring the capsule in a little bit closer, and when I deliver my meniscus doesn't decrease in its size because of me putting a fixation to the posterior capsule that's far away from the articular surface, and because the biggest problem is undersizing. So this is actually helpful. So now let me see a targeting guide also curved to the left. So here we go right on the edge of the plateau. This particular one will be in the middle. The posterior horn one will be closer to medial, and the anterior horn one will be closer to lateral. Perfect, awesome. Let's see the filament. There, ooh, nice. Great. Okay, so we'll pass the centralization stitch down the tunnel, like so. The capsule is now a little bit brought in, and it will help with our meniscus placement. So this is very nice. I will now go ahead and prepare out the lateral meniscus posterior root insertion. I remove some of the remaining soft tissue of the root here. Okay, so this is prepared. We go in with the curette. We prepare out and make this a bony bleeding surface. And then I take the tip aimer again. We'll deliver our tunnel. So here we want to stay about 1 centimeter if we can, medial to the previously drilled centralization tunnel, so that these two tunnels will not cross in the end. And there's usually plenty of room to do this, even in a very small knee such as this one. Okay, very nice. All right, go ahead and drill this up. So I'm going to take the bullet off. Okay, go ahead and advance. Nice. Perfect, perfect, perfect. I like the spot. Try to be as anatomic as possible. There it is. This next step is very critical. You need to, at this point, dilate the portal. Otherwise, you will never get this in. And the size of your portal should be roughly as big as your pinky finger. I use my pinky finger to dilate. So at this point, I pull the suture out, and then we deliver the transplant. Now I bring the transplant in, and in my first step, all I'll be doing is delivering the suture. Suture coming down. That's it. I'm going to take a cuff grasper to deliver the meniscus gently. like so. I'm going to be pulling down on the suture here, deliver the meniscus in. So now the meniscus is delivered where I want it. I leave the rest of the meniscus still out of the portal for now. So now, together with my meniscus, I will put the scope in that same portal and deliver my first fast fix suture from the anterior medial portal. So I use the orange one for the upper surface here. There you go. Through the capsule. Number one. Come out carefully so not to pull the whole meniscus back into the joint. Deliver the second stitch through the capsule. Voila. Give me the Novo cut. I don't like pulling too much on this suture. I rather push and pull. There you go. And just take the tension out. This is very nice. The lower surface of the meniscus curls up. That's okay. We can place balancing sutures later. I'm going to put my next stitch in. Ideally, you want to avoid going too much in the popliteus because, again, it will decrease the mobility of your meniscus. So if I go in here, joystick, and curve a little bit away from the popliteus, I can just go through the most anterior edge and probably for the most part avoid the popliteus. There you go. Like so. And again, right, so here's popliteus. I'm going to go right anterior to it and probably just avoid the popliteus there. And again, push and pull. Take the slack out, but no more. Just like this. Cut. I go through the meniscus, but not the capsule yet, just a few millimeters. And now I can lift up the meniscus, I can lift down the meniscus, I can put it where I wish it to be. In this case, I like to just be in the middle, so I call that joysticking. There you go. And back into the capsule. Okay, nice. There you go. Take the slack out, but no more. Okay. And I'm going to fold that meniscus down to make it look nice. I'm not sure this matters a ton, but it will certainly look much better. There you go. Okay, and so now I'm pulling the slack out a little bit. How about that, huh? Look at this. You ideally would like it to be not too much extruded, hence the centralization, which kind of brings the meniscus in. If you see that, that's really nice. Now that we confirmed that the meniscus is going to have the appropriate size, we're going to make the anterior tunnel. We're going to do it again with the ArthroCare, which is really the perfect device for this, I have to say. And then with the root curette if you need to. So now we have a third tunnel through the same incision. So this tunnel is going to be very short, sometimes only about 1 centimeter short, so be aware of that when you drill. And you may also need to extend the knee slightly so that you can get your drill there. Okay? Be mindful, very short. Nice. Okay, so next we'll deliver the anterior root suture through the anterior root little filament. We'll pull this down. So you have to make sure that the meniscus isn't rolled up on itself. But I think we're looking good. Now pull the suture for the anterior root down. It's a little bit turned. It's actually not bad. So I think I would accept this. You can bend in 2 areas. So one, I can make a bend here. If I want more, which I don't think I want in this case, but I can bend beyond this little black marked spot and give it more. This is probably my most anterior stitch I want to place. So this goes in nicely through meniscus and capsule. Okay. There you go. All right. Okay. So this is really it. You can put another 1 or 2 sutures in there, but this is your transplant. Voila. So here we go. This is our transplant. Here are our 3 stitches. I do the centralization one first. So I'm going to go at about 60 degrees of flexion. I want to tension this tight, but I'm being mindful that I don't have the best capsule that I dealt with here because the previous meniscectomy was complete. So I'm going to keep the tension at a moderate level, otherwise you will rip through this. So be very careful with this. This is not about the size and strength of your suture, but it's the material that you're suturing. I can see that my root is perfectly reduced. I'm happy with this. Maybe at 60 degrees. Okay, so again I do a 2-handed knot. I hold tension on my post now. On this one I can pull a little bit harder because I tested this at the back table and I really like the strength in there. You better test that really well. If it comes out, it better come out on the back table, not now. Okay, this is my anterior root. 200 knot, there you go. So here we are. This is a nice meniscus transplant. Again, my indication for meniscus transplant would be a little bit stretched with this much chondrosis. I have fast fix sutures in the posterior horn 4 times. I have one on the lower surface and horizontal mattress to balance this. I have a mid-body fixation, and I have my last fast fix fixation in the anterior horn body junction. And the most anterior part is really only fixed to the root because you do need mobility. And the anterior root is nice and stable here. It is fixed to this bony sliver. This is awesome. And then you have the endo button party here. So right there, 3 endo buttons. 1, 2, 3. You gotta love it. After the transplant is complete, my patients undergo a rehab protocol in which for 6 weeks they use crutches, no weight bearing. For the first 4 weeks they have 0 to 60 degrees of motion. After 3 months they get an unloader brace of the ipsilateral compartment and no deep bending for the first 6 months. No running for 1 year.